I mean, detection in the first place is, there's lots of work going on right now, looking at the amyloid markers are more difficult in blood than they are in CSF, because of the fold change is so much smaller than you see in CSF. So that's quite difficult, although I know in the States they are using immunoprecipitation mass spectrometry methods, which are actually available at I think you can buy tests and they're licensed in America, but nothing like that is here yet. But I know that lots of people here are really interested in the phospho-taus because they seem to track, or they seem to correlate so well with amyloid PET in the brain and also tau PET as well, that I feel that efforts are being made towards trying to, validate either phospho-tau 181 or 217 for clinical use in the not so distant future. Because if you think about diagnosis, if all the research stands up and we can see that we have cutoffs, values for normal and age and everything like that. If all that stands up and you can just do one blood test and measure phospho-tau and it's high, that doesn't say that you do have Alzheimer's disease, but what it does say is perhaps we need to go a little bit further. We need to send you now for a lumbar puncture or a PET scan or something. But at least in that way, it makes that first step, hopefully puts that person on the path to a diagnosis, in a more, in an easier and more accessible manner than is at the moment, because I think many people just don't ever really get diagnosed properly. They don't go to a neurologist. They don't go to a memory clinic. There just isn't there aren't enough of them. So that can't happen. So I guess for the phospho-tau looks promising in that respect. I think that there would need to be an awful lot of, I suppose, education about the tests and how primary care could use them. But obviously that would happen if they were going to bring something like that in. For example, if they license disease modifying treatments in this country, for example, lecanemab, they would have to have a better way to diagnose people. And I know that there are lots of kind of real world studies going on, or at least being talked about, applying for funding for at the moment, so that we can enable that much better than we do at the moment.